There's nothing more important than the right diagnosis. Here today, we're going to talk to you guys about how so many people are misdiagnosed with so many simple things, from neck pain, herniated discs, bone-on-bone pain, migraines, hormonal migraines, and other kind of ailments.
Sure. We didn't mention GYN.
Oh, we can always talk about GYN,
Okay.
since Jade is our specialist on women's health and pediatrics.
That's right.
Yeah, so let's just talk about some seasonal things right now. So right now we have a lot of allergies happening. We have migraines that are persistent with many people, and what I'm seeing a lot in the clinic right now is a lot of migraines, a lot of dry eyes, a lot of teary eyes, watery eyes, allergy-related conditions right now, and that they're going to their doctors or they're going to a healthcare provider, and they're being told that you have this type of migraine or you have these type of allergies, and you need this kind of medication. What I'm seeing in the clinic now is kind of disproving a lot of what they're coming in with. Not to say that your migraine isn't real, that's very real, and it's extremely debilitating.
Mm-hmm.
Now, they're being told that these migraines are hormonal, or because of something unexplained why they're having these migraines, or it's genetic, or it's hereditary. I start working on a patient's neck. I go right to their neck, and there's tons of stress and tension, a lot of constraint in the area, and just some simple acupuncture in that area, loosening up the neck, and mysteriously these hormone migraines disappear,
Right.
or they're 80% better. And these patients are told, you need this sort of drug or medication, or let's try some things, but the success rate may be very hit or miss. And in one treatment, 2 treatments, 60, 80% resolved. And that's just migraines mixed with allergies, mixed with the season that we're having right now.
Right. Yeah, I find a lot of patients are coming in that they haven't had allergies before. And I think we've touched on this in other videos, but they haven't had allergies before, but they're feeling it more this season. And, there's different pollutants in the air, mold, and they may go to the doctor, and the doctor, wants to prescribe them medication that doesn't necessarily give them relief because, allergies can be very patient specific. You never know what can trigger it. But with one treatment, they're feeling better. They're feeling the relief of that pressure that's in the face, that post-nasal drip that comes on sometimes with these allergies. They're getting lasting and deep relief. So there's definitely other options besides going straight to the offered prescriptions.
Yeah. I want to specifically for 1 second talk about pain conditions right now. So I just had a patient come in, 70-year-old guy. He's in pretty good health. He's a super of a building for the last 28 years. I'm gonna have a little bit of a story on him. And he came in with extreme neck pain, pain in the trap area, and then he had some pain shooting down his inner bicep over here.
Mm-hmm.
And he went to his doctor, and the doctor says, well, there's a lot of arthritis in the area. We took an x-ray. There's a lot of arthritis. You could take some pain pills, some pain medication, and let us know how it is. Now, I have a history with this patient. He sees me once in a while, every year or so. And he goes, can you do anything for me? I was like, come in, let me examine you.
Yeah.
Because I just don't want to take the x-ray verbatim, because x-rays are good and they're helpful. MRIs are good and they're helpful as well. But they do have downsides to them. So he comes in and I do just some basic functional tests with him. I press down on his head. I lift up on his head. And that's a specific orthopedic test. It tells you a lot. And I pushed down on his head and made the pain worse. And I pulled up on his head and it made the pain a little better. I was like, okay. So we have compression this is called the cervical. Mm-hmm. So there's compression in there, pressing on the nerves. And, he's 70, so could he have some arthritis? Of course he does.
Sure.
They're just reading the x-ray on what they can see. They didn't put their hands on the patient at all. I was like, okay, Nick. So we're going to do some points right now to relieve that tension in the neck. So I do some points on his neck. And I was like, okay. I took him out. And I was like, how's your neck feel now? And he
Right.
goes, wow, that's like 40-50% better
Wow.
in 5-10 minutes.
Right.
I was like, and I'm not excited about it. I'm not excited about it because, some people can have compression in there and arthritis or other factors, and you hit a wall where you can only make it a certain percentage better. I was like, okay, so this shows some signs of promise. I'm very conservative with the numbers and what kind of success I get. And I want to prove that this is absolute and this is true, and I can really help him. I'm like, all right, so let me do some more work in the neck. So I did some more points in the neck. He got up, more relief.
Nice.
Awesome. All right. And then I picked a point around his shoulder because I was like, I got to see what I can do for this odd pain that's coming down into his bicep, like I just showed you.
Yeah.
Because, I mean, it really does. It's really a major flag of something nerve related.
Right.
And so I stretched him out on top of that, and I stretched the entire neck area. Now 50%, 60% of that pain into his bicep was feeling better. So, and Nick, he's a very conservative person, and he's 70. He's a great guy, but he really calls it how it is.
Right.
And I always tell all of my patients, really, when I ask you how much better do you feel, I really want you to be conservative about it. I want real numbers, and I want real outcomes, not, to make me feel like it didn't work.
Right.
Right. I really want the honest answer because, okay, I can help you, or I can send you to somebody who can help you.
Right.
And you don't waste or lose time on that. And that's very important to me, that even if the step of care that involves me is sending you to somebody that can help you the first time, that I feel like I did something there. So I sent him on his way, and he left saying, I said, okay, so you're conservatively saying that you feel 70% better? I was like, that sounds like a very high number.
Yeah.
He says, no, it's more, but if you want to call it 70, we can call it 70.
Oh, wow.
And I was like, okay, all right. So he says, when do you want to see me? I was like, well, I'll see you next week.
Right.
It might come back, it might not, but whatever the story is, it's going to tell me more about how I can help you, or if you need to be referred to a specialist.
Sure.
He comes back. He retained the entire percentage of feeling better.
Wow.
He retained all 70%. It didn't go back at all. I was concerned because he's a super in a building, and he works very hard with his hands, lifting, under cabinetry, everything like that.
Yeah.
It's a very physical, demanding job. And he's a lot of energy, so he's passionate about really getting hands on. It's inspiring, really. So he comes in, and I repeat a very similar treatment for him, and then he leaves 95% better. And I give him a call, and he's gonna come in for another visit. But I'm saying, but if you don't feel like you need to come in, that you're better, he says, oh, I just want to come in. And I was like, don't come in if you feel 95% better. In fact, we're gonna test it by wait. If you feel good for a week, let's see what 2 weeks is.
Right.
What's 3 weeks now?
Right.
And so in a couple of days, I'm going to check in with him to see where he's at. Because if you're not hurt, I don't want to see you.
Right.
And that's just one case of his neck pain. He had an X-ray done. X-rays, they don't see the nerves.
Right.
They can only see what they see: arthritis, fractures, other bony deformities. In some cases, severe tumors, and so X-rays are very good in that regard.
Right.
But sometimes arthritis is not the whole story about what your pain is. Even if they can see where the herniation is, and you're having pain in your back, you're having migraines, sometimes I find 40% of the time the pain that you're experiencing is from somewhere else, not related to that condition. But because that's all that they see, that's drastic, they're just calling it's part of your herniations, part of the bone on bone, it's part of your hormone change. But they miss something that's small but causing major pain.
Right.
So by coming in and getting a functional test where we actually put our hands on you, move you around, test different positions.
And retest.
Retest.
Yeah.
We treat, we retest, we treat again to make sure we're getting results, or definitively not results, to then say, yes, this X-ray was correct in saying that this is 90 to 100% of your problem, or you know what? It looks like 50, 60% of your pain is not the arthritis. It's also something else that we can help you with. And yes, you might max out at feeling 50% better, and that's all you can be because you have a bone or structural problem.
Yeah.
But you know what? If you were an 8 out of 10 out of pain, and now you're a 4 out of 10 every day permanently, that's a different life you have now.
Improvement, yeah.
Yes, it's not 100%. A lot of things aren't 100%, but that would be an amazing increase. Just another quick story. I had a patient come in with neck pain and then arm pain, and so I did the same testing. This is interesting because it's a different outcome with this. Is I pushed down on her head, it felt worse. I pulled up on her head, it felt better. I treated her neck, and her entire neck, her entire back got better, but her arm got a little better, but it stopped.
Right.
And so she came in for another treatment, and I retested, push down on her neck, pull up on her neck. It didn't change the pain in the hand and arm now.
Wow.
I was like, yes. So this means that we resolved the head and the neck, and it did help the arm somewhat, but now there's more to the condition than just the neck. So now it could be the shoulder, it could be the elbow, it could be the wrist, or anywhere in between.
Right.
And then I stretched out the arm, no change. I finally got to the wrist, and it turned out to be carpal tunnel.
Wow.
And I did a carpal tunnel points, resolved 70%.
Awesome.
In one treatment.
Yeah. And
so those are two different cases, but similar symptoms with similar testing, but not taking no for an answer.
Right.
Really.
Or running with the initial diagnosis and saying it is just this or it is just that. Doing the testing during the treatment is so beneficial because you're getting that instant feedback from the patient. You can find out, you have a starting point, you treat, you test again, and now you can see if there's progress, no progress. It's a great technique.
I don't believe in prescribing or recommending someone do a series of 8 or 10 treatments without doing some sort of evaluation every single time they come in, because even though you could use 10 of these treatments,
sure,
but if you could modify the treatment to be even more effective 3 treatments in, why wait for 10 treatments?
Yeah.
Whether you go to any kind of pain specialist, Acu, PT, Chiro, ortho, wherever you go, any kind of rehab, a lot of times they could recommend, we're going to do this for a week or 2 or 3. And a lot of times the treatment plan stays the same when the patient changed.
Yeah.
And it wasn't caught soon enough. And I'm not saying that people aren't doing a good job. They're doing a great job.
Yeah.
But I get a lot of feedback from patients saying, I'm going to this place and I'm getting this therapy, and I feel like they're doing the same thing, and it seems like I'm not getting better for a while now.
Right. Well, they hit a wall where they improve at first,
mm-hmm.
and then they maybe get to a point where it kind of plateaus, but there's still the same points or the same procedures or therapies are still being used, even though the patient is not, in making any changes in healing. So, yeah, that definitely, testing and retesting and checking in with the patient more regularly is definitely imperative in ensuring they're getting the best treatment, making sure that you're giving them the best recommendation every time. It's important.
Now, that was just a little bit about headaches, neck pain, arm pain, different pains in the body. But one of your specialties is women's health, GYN, and children. Can you think of a case that's somewhere where you've helped someone like that or heard about?
Yeah, I think, in the case of GYN issues, sometimes, in a case that I know of, the patient was having constant painful periods. Mm-hmm. It was going on since like her youth, and it took her a long time to get diagnosed properly. It wasn't until she was trying to conceive that they kept saying it was IBS, and she was getting even treatment for that, and still, not getting much better. Maybe some improvement, but not really what she was looking for. And it wasn't until she was trying to conceive later on that she ended up realizing that it was actually endometriosis. So it's if you came to an Acu, our styles of diagnosis are a little different in where we diagnose by pattern. We're not necessarily diagnosing by, blood test results, or we can use all this information, and it's supplemental to us. But if she had seen an acu much sooner, we would diagnose that something as like blood stasis and maybe give treatment for that, and it could have been caught a lot sooner. So I feel like people need to have the knowledge that there's more than one way to be diagnosed, more than one way to get to the root of an issue, and to maybe even address the issues that they are already diagnosed for. And that's what we're here for, to provide more options.
And that was really interesting. What you're saying is that she was diagnosed with IBS, and then it wound up being endometriosis. Two very significant and severe conditions.
Yeah.
Very severe in a lot of cases. That if they would have seen more of a holistic provider, like an acupuncturist, someone who practices Chinese medicine, because we look at different patterns of the body, we would have seen that the IBS, even though it's very close to the uterus, it wouldn't have quite lined up for us.
Right.
And we would have been helpful with their pain and with the fertility aspect of it. But we also would have been recommending, you know what, you need to go see your GYN.
Right.
You need to go have a pelvic exam, like an ultrasonic pelvic exam.
Yeah.
Take a closer look, because those organs are so close together.
Right.
That, that may not be the whole story. And more oftentimes than not, there is a cumulative pattern. There could be multiple things.
It's layers. Yeah.
Or it's an organ right next to the other one instead that they unfortunately missed. And that is a really big misdiagnosis between endometriosis and IBS, when her goal is to have a family and children.
Right. And initially the goal was to just stop the painful periods.
Mm-hmm.
But later on is when she was trying to conceive, is when she really got to the root of her issue. So it's just interesting to hear patient stories and be able to offer them different options and different ways to approach their healing.
So just to give a little recap, if you are suffering in pain and nothing's helped you, or not really working, or you feel like you're stuck in a plateau and you're doing something and I don't know, you just don't feel like you're getting the help you need, or you need something to add to the current therapy you're getting, I always recommend a free consultation with an acupuncturist. You can text us, you can call us. We're always happy to advise, even if you're not in our state. If you're in the United States, hopefully on the same time zone.
East Coast.
No, we'll still take your call in different time zones.
Yeah.
If we can point you in the right direction for help or care that you need, I don't want anyone to be hopeless.
Right.
There could be, we know between Jade and I, we know a lot of other healthcare professionals, that are doctors or other kind of specialists that we know well. We know what specifically they're very good at treating, and they've told us to send us these types of patients, whatever category you might fit into.
Yeah.
And I don't want anyone to be hopeless and, start to get depressed and anxious and emotionally unwell from their pain or their condition. And you might have already seen an acupuncturist. You might have already seen a chiropractor or a medical doctor or an internist or an endocrinologist. I have an endocrinologist I refer to all the time. She has a 7-month waiting list. But I have so many patients who've gone to her that they've changed their lives in that one time that they've seen her. When it comes to certain chronic conditions, if you get the wrong diagnosis and then the wrong medication, it can put you on a spiral for 3 years.
Yeah.
3 years. So even though waiting to see that person might be challenging, it's shorter than 3 years.
That's
and then you'll have a lifetime of happiness.
Right. A
So
complete change
please
in quality of life.
Call us, message us, talk to Jade and I. The front staff will take your call or text, and we want to get you on the right track.
That's right.
Take care.